Hi, my name is Dr. A. William Blackstock. I'm chair of the Department of Radiation Oncology at Wake Forest Baptist Health, and I'm here today to talk to you about radiation oncology. It is likely I'll be one of many physicians involved in the treatment of your cancer. Cancer today often requires different forms of treatment. That treatment could be chemotherapy, which is delivered by the medical oncologist. It could be the surgery, which is performed by the surgical oncologist, and then the delivery of the radiation, which is by the radiation oncologist. It's very important, if you're going to receive more than one form of treatment, that that treatment is coordinated with the other forms of treatment you may be receiving, in particular to get a successful outcome. Radiation oncology is a local form of therapy. What I mean by that is the radiation is only aimed at the tumor. Unlike chemotherapy, which can be systemic or involve the entire body, radiation is very focal and again aimed at the specific area that we need to be treated. It's a very precise therapy. We measure this in millimeters in terms of accuracy. In radiation oncology, this involves the delivery of an X-ray beam. Again, this beam is aimed specifically at the tumor with an ability to kill tumor cells, specifically cells that are dividing. And tumor cells tend to divide faster than normal cells, which gives us an advantage with radiation to kill those cells and not the normal cells. In radiation oncology, there are a number of forms of radiation. The standard radiation is called external beam, and that's when patients come daily, 5 days a week, and the radiation is given from a machine and enters the body externally. A second form of radiation is called seed implants, in which radioactive seeds are actually implanted in the body and deliver dose locally. And then a third form of radiation, which is more new and novel, is referred to as stereotactic. It would also be considered gamma knife, in which we're given big doses over short courses of time, and that's been shown to be effective in brain tumors and lung cancers. The safe delivery of radiation requires a team, and that team not only involves me as your physician, but at a teaching hospital, it may involve a fellow or a resident. It also involves a nurse who will be taking care of you during the weeks of radiation that you're receiving, and the radiation is actually delivered by the radiation therapist. And at any time, those folks are available to you for questions. In terms of planning the radiation, after the initial consultation, we'll bring you back several days later. We'll obtain a CT scan with you in the treatment position, which is important in terms of making sure the radiation is delivered accurately. We will then take the images from that CT scan, put it in the computer, and me and the physicist will spend days looking at the best plan to treat your tumor. It's important we make sure we hit the tumor, but it's also equally important that we miss normal structures and tissues that don't need to be treated. Once that treatment plan is put together, we invite you back. We do what's called a verification sim. That's just a word to say we do a dry run or a test run. We then make sure that everything's lined up perfectly. Again, we only accept millimeter error in this field. And once we understand that everything's lined up perfectly, we bring you back for treatment. Once the treatment planning is completed, you then start your daily treatments. This would involve you coming in once a day, 5 days a week. You come back to the machine, you lay on the machine, and we make sure that you're positioned accurately to make sure that the dose is given where we want to give the dose. You don't even feel things when the machine are on, but you do hear the machine when it's turned off and on. 20, 30 minutes later, the treatment is completed, and that's done for the day. You will see your physician several times a week to make sure you're not having side effects that we need to be aware of. The side effects associated with radiation therapy are often limited to the area that's being treated. But one general side effect is fatigue. It usually sets in within 1 to 2 weeks of the treatment and usually grows gradually worse over the course of therapy. The good news is that once the treatments are completed, this fatigue usually resolves. Because the delivery of radiation does require several weeks, it's important that you express side effects that you're having during those treatments. That can be discussed with the nurse, the therapist, or the physician. But it's important that you share that information so we can make sure we manage those side effects appropriately. Once the treatments are completed, we then move into follow-up mode. And what I mean by that is we need to see if the treatments were effective and to make sure you're not having any side effects after the treatments are completed. This would involve coming back to see the physician every several weeks or every several months, often with an imaging study like a CT scan, just to see how things are doing. Over the last 30 to 40 years, the technology associated with radiation oncology has evolved immensely. Our ability to deliver radiation precisely has improved, and more important, our ability to avoid those areas we want to avoid, normal tissues, has improved. And if you do have questions about side effects associated, please ask your physician about that. There are a number of different programs available to cancer patients. I would encourage you to take advantage of those programs like Guidepost of Strength, which will help guide you through your journey with cancer.